Zoledronic acid 5 mg per 100 ml in mannitol and water. Intravenous Piggybck is utilized to treat Paget's disease and osteoporosis in both men and women. It helps to prevent and treat bone loss by slowing down the breakdown of bone and keeping bone strong. It is also beneficial for people who are taking corticosteroid medications for long periods. This medication belongs to a class of drugs known as bisphosphonates. It is essential to take the recommended daily dosage at the optimal timing to achieve the best results. Before using this medication, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Zoledronic acid is given as a single dose as directed by your doctor, slowly into a vein over at least 15 minutes. The dosage is based on your medical condition and response to treatment. On the day of treatment, make sure to eat and drink normally. Drink at least 2 glasses of fluid before treatment, unless otherwise directed by your doctor. It is important to stay hydrated when taking this medication. If you are giving this medication to yourself at home, make sure to learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. Make sure to learn how to store and discard medical supplies safely. Do not mix zoledronic acid with 4 fluids that have calcium in them, and talk to your pharmacist for more details on this. Your doctor may direct you to take calcium and vitamin D each day. If you have Paget's disease, it is especially important that you take the directed amount of calcium and vitamin D during the 2 weeks after your zoledronic acid dose. Vitamin D and calcium are very important to prevent low levels of calcium in the blood. Tell your doctor right away if you have any symptoms of low calcium such as numbness/tingling and muscle spasms. For the treatment of Paget's disease, this medication is given as a single dose and may be repeated based on your symptoms. For the treatment of osteoporosis, this medication is given as a single dose once a year. Make sure to talk to your doctor about the risks and benefits of long-term use of this medication. Some common side effects of zoledronic acid 5 mg per 100 ml in mannitol and water. Intravenous Piggybck may include nausea, tiredness, flu-like symptoms, dizziness, headache, or pain/redness/swelling at the injection site. These side effects are usually mild and occur within 3 days of treatment. If you experience flu-like symptoms, you can reduce them by taking acetaminophen or ibuprofen after the treatment. If any of these effects worsen or last more than 4 days, it's important to tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of side effects. Serious side effects are rare, but it's important to tell your doctor right away if you experience any increased or severe bone/joint/muscle pain, new or unusual hip/thigh/groin pain, jaw/ear pain, unusual weakness, eye problems, muscle spasms, numb/tingling skin, irregular heartbeat, sores in the jaw or mouth, signs of kidney problems, or seizures. In the event of a serious allergic reaction, seek medical help right away if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Before using zoledronic acid, make sure to inform your doctor or pharmacist about any allergies you may have, as well as any medical history you have, including kidney problems, low calcium levels, and recent or planned dental surgery. Some people using zoledronic acid may experience serious jawbone problems, so it's important to have regular dental exams and to inform your dentist that you are using this medication. Before any surgery, let your doctor and dentist know that you are using zoledronic acid, as they may advise you to stop using it temporarily. This medication may cause dizziness, so it's important to avoid alcohol or marijuana while using it. If you are pregnant or plan to become pregnant, it's important to discuss reliable forms of birth control with your doctor, as zoledronic acid may harm an unborn baby. Lastly, it is unknown if this drug passes into breast milk, so it is not recommended to breastfeed while using this medication. When taking zoledronic acid 5 mg per 100 ml in mannitol and water. Intravenous Piggybck, it's important to be aware of potential drug interactions. Certain medications may alter how this drug works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with zoledronic acid is calcium-containing 4 fluids. Additionally, there is another zoledronic acid product used to treat bone problems associated with cancer, and it should not be used together with this medication. Always consult with your healthcare provider to ensure the safe and effective use of this medication. If someone has taken too much of this medication and is experiencing severe symptoms like losing consciousness or having difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can reach out to a provincial poison control center for assistance. To promote healthy bones, it's important to make lifestyle changes like increasing weight-bearing exercise, quitting smoking, limiting alcohol, and eating balanced meals with enough calcium and vitamin D. Your doctor may also recommend taking calcium and vitamin D supplements. Before starting this medication, you will need to undergo medical tests such as blood levels of calcium, phosphate, and magnesium, bone density tests, and kidney function tests. It's important to keep all medical and lab appointments and consult your doctor for more details. Zoledronic acid 5 mg per 100 ml in mannitol and water. Intravenous Piggybck is used to treat high blood calcium levels caused by cancer. It is also used to treat Paget's disease of the bone. Zoledronic acid is also used to increase bone mass in men with osteoporosis and in women with osteoporosis who have been through menopause. It is also used to treat bone damage caused by multiple myeloma or by cancer that has spread to the bones. Zoledronic acid is also used to treat or prevent osteoporosis in postmenopausal women. It is also used to prevent or delay bone problems in patients with multiple myeloma or bone metastases from solid tumors. Be sure to follow the storage instructions provided with the product and consult your pharmacist if you have any questions. It's important to keep all medications out of reach of children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it down the drain unless you have been specifically instructed to do so. Instead, dispose of the product properly when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.